Hello and welcome to I Got You, your go-to for honest, simple conversations about vision, eye health, and general wellness. I'm your host, Dr. Valarie Jerome, optometrist and total eye nerd. No jargon, no hype, just real talk, grounded in care and expertise. Because your eyes matter, and so do you. This is a space where you're going to feel heard, seen, and supported. And you're going to get some information that you can actually use. So don't worry, I got you. Losing sleep, losing sight, the link between obstructive sleep apnea and vision. I'm Dr. Valarie Jerome, and this podcast is all about sleep apnea and the vision. Today, I'm talking about obstructive sleep apnea and how it can literally affect the way that you see the world. So if you've been waking up tired, feeling groggy, foggy, wondering why your eyes are acting weird after a full night's sleep, this one's for you. So what is sleep apnea again? Here's a quick overview. Sleep apnea, especially obstructive sleep apnea, which I'll be talking about today, is the most common type of sleep apnea. And this is when your breathing stops and starts during sleep. With obstructive sleep apnea, there's a lack of oxygen to your optic nerve. And this happens usually because your airway gets blocked, your throat muscles just relax a bit too much. So what are some of the signs? Snoring like a bear, gasping for air at night, waking up a lot during the night, and feeling absolutely exhausted the next day, even if you've slept, quote, slept for 8 hours. The thing is, a lot of people have no idea they have sleep apnea, and it just gets written off as being a bad sleeper or just tired. But here's the kicker. When your brain and your body are not getting enough oxygen while you sleep, your eyes, well, they're going to suffer too. And it's estimated that nearly 80% of men go undiagnosed and 90% of women go undiagnosed with obstructive sleep apnea. So how does obstructive sleep apnea mess with your eyes? Okay, so here's what gets real and it gets a little serious. Obstructive sleep apnea causes drops in oxygen levels throughout the night. Your optic nerve, which connects your eye to your brain, needs a steady flow of oxygen in order to stay healthy. Think of your optic nerve like it's the fiber optic cables. Your eye is a camera, it's taking the picture. Your brain is actually the part that sees, and the optic nerve fibers are ever so important to get that information back to the brain. And what happens if your optic nerve isn't getting enough oxygen? Well, you're going to be at a much higher risk for some pretty serious eye conditions, including glaucoma, especially something called normal pressure or normal tension glaucoma. Now, remember, glaucoma is a silent disease of the eyes. You don't often know you have it until it's in the later stages and vision is lost. There's also something called non-arteritic anterior ischemic optic neuropathy. Now, that's a big fancy name, but it's a scary result. And basically, it's a stroke of the optic nerve. And then there's the floppy eyelid syndrome. Yes, that is a thing. Your eyes become unusually loose, and that can cause irritation and dry eyes. And 95% of people with floppy eyelid syndrome will actually have obstructive sleep apnea. Now, one of the ways I check for it is when I'm at the slit lamp microscope, I pull down on the bottom eyelid, and if it's sort of loose there, I'll ask, hey, do you snore? And they're like, yeah, how do you know? And then I'll ask them to get checked for obstructive sleep apnea. Also, that lack of oxygen can cause retinal vein occlusion. Think of that like an eye clot where it gets poor blood flow to the retina. And there's much other things that it can cause. Now, here's the wild part. Some people don't even have obvious symptoms until the damage is already happening. And that's why it's so terribly so important to connect those dots early. You ask, well, what are some of the signs that your eyes might be saying, hey, something's up? Well, you might have blurry vision in the morning. If your eyes are strained or fatigued, if you have redness or dryness, it doesn't go away. Headaches, light sensitivity, changes to your night vision. If you're missing patches of your vision or feel like you've had vision loss. Again, none of these automatically mean obstructive sleep apnea, but if they're happening and you're waking up feeling like you got hit by a truck, it's worth checking out. So who's at risk of getting obstructive sleep apnea? Men are far more likely to get it than women. Also, people with a neck circumference size of 17 inches or 43 centimeters in men, 16 inches or 41 centimeters in women are more likely to have obstructive sleep apnea. If you're a smoker or with increased age, then your risk goes up as well. So I've told you all this. What can you do about it? All right, first of all, let's take a deep breath. The good news, there are things you can do. And no, it's not just about using that CPAP machine and calling it a day. If you snore, if you're feeling tired all the time, if you have any of the symptoms that we talked about, ask your doctor, your GP, your primary care doctor about a sleep study. And remember to use the treatment. If you do have sleep apnea, using a CPAP or other treatment can protect your eyes and improve your overall health. I actually saw a patient recently. He didn't realize how important the CPAP machine was, and he had optic nerve damage, and he lost sight in that eye, sight that he can't get back. And keep your eyes in check. Schedule those regular eye exams, which I'm always preaching about, and your optometrist or ophthalmologist can spot signs of sleep apnea before you even get diagnosed. A bit like those floppy eyelid syndrome. So remember to support your sleep. So the experts say to sleep on your side, avoid alcohol before bedtime, try to maintain a healthy weight. Remember we talked about the neck circumference size. And I'll share a personal story. My husband, he recently was a snorer, and I was concerned about sleep apnea with him because his breathing would be interrupted during the night. He went on a big health journey. He's lost weight, and he now, thankfully, no longer snores. And his risk of obstructive sleep apnea has been reduced. And as his optometrist and as his wife, I'm very thankful for that. Also, remember to keep your bedroom cool and dark. And try to avoid naps. Naps? What are those? Oh, those were the days, weren't they? And exercise daily. Also, you can use the didgeridoo, and I never know if I'm saying that right. Didgeridoo. That helps to strengthen those upper airway muscles, but warn your neighbors first. Now, all these little things really do add up. So what's the takeaway from today's podcast? Well, just remember your eyes and your sleep are deeply connected. And if you're not getting quality rest, your vision might be paying the price, even if you don't notice it right away. And remember, vision loss from conditions like glaucoma, non-arteritic anterior ischemic optic neuropathy are often irreversible. And that's why catching sleep apnea, obstructive sleep apnea in particular, early can literally save your sight. So thank you for tuning in to this episode. And if you found this helpful, please share it with a friend or someone who snores but swears they're fine. Thank you so very much for listening to the I Got You podcast with myself, Dr. Valarie Jerome. Just a little reminder, everything that we chat about here on this podcast is for info and entertainment purposes only. So if something's a little blurry, itchy, or not quite right with your eyes, book in an eye exam with your eye care provider. Take care of yourself and take care of your eyes.